Hi, I'm Dr. Atkins. I'm the Medical Director and owner of the Cosmetic Enhancement Center of New England. We've been providing cosmetic and aesthetic treatments for nearly 30 years and are pleased to provide you with this full-face rejuvenation educational event featuring the latest advancements in dermal fillers and wrinkle relaxers. By joining tonight's event, you will have the opportunity to submit your questions by the Questions tab and have them answered live. So please stay tuned until the end for our live Q&A. As a thank you for attending our event, you qualify for an exclusive promotion. Purchase 100 units of Daxxify and you'll receive a half a syringe of RHA filler for free. This is a $350 value. This offer must be purchased by the end of the month. Also, everybody in attendance will qualify for a raffle for a completely free Daxxify treatment. Thank you and enjoy the event. RHA Redensity is a filler that can be used to smooth out fine lines in the upper lip and vertical cheek lines. It is placed superficially within the dermis in order to create a smoothing effect. RHA 2 is a filler used best to treat the lip for subtle volume, for those who just want a slight replacement for their lip volume. RHA 3 is perfect for those who want a little more volume in their lips and for support around the lips and the mouth, the nasolabial folds, and the marionette lines. RHA 4, being a little more robust than the other fillers, it is best suited for cheeks, chin, and jawline. Who is a good candidate for RHA fillers? Basically, anyone who has lost volume in their face and is needing subtle replacement for laxity that they've developed over time. RHA fillers are immediate, just like any other hyaluronic acid filler. You will see your results immediately after treatment. As with any filler, you will see an improvement over time, usually about 2 weeks to see your full effect, but definitely an instant improvement.
Let's go. Ain't no other like we. Running things so easy. Cross the country like me. That's you, that's me, that's we, that's we. Ain't no other like we. Running things so easy. Cross the country like me. That's you, that's me, that's we, that's we. I'm a diamond, one of a kind. Cut 10 face like a Gemini. I shine when I'm in the light. Catch a knife, but I'm in a different climate. I'm a diamond, one of a kind. Cut 10 face like a Gemini. I shine when I'm in the light. Catch a knife, but I'm in a different climate.
Neurotoxins are best used to inject areas that have wrinkles that have developed from movement of the skin. They're used to relax the muscles causing the lines. For instance, the crow's feet, the frown lines, and the forehead lines. Daxxify is the newest neurotoxin on the market. It has been around for a couple of years now and has increased longevity over the other options. It can last 1.5 to 2 times other neurotoxins. The other benefit to Daxxify is that it has peptides in it that help with its binding properties. Another benefit is that it has no animal or human byproducts and it starts to kick in very quickly. You will see your full result within 5 to 7 days. Your last Botox is in October, and it looks like we did primarily the forehead. You did a little bit around the eyes, but your forehead looks really good right now. It's like really still holding there, but your eyes have kind of dissipated faster. Smile big for me? Yeah. Let's maybe consider switching to Daxxify for at least the eyes. The Daxxify is a FDA-approved neurotoxin that actually is lasting 6 to 8 months for most people. It's not going to necessarily be that for somebody who's not getting long enough for Botox. So if you're getting 3 to 4 months out of Botox, you might get that 6 to 8 months out of the Daxxify. But if you're only getting 2 months, like you have with the eyes for the Botox, then you may only get 4 months out of the Daxxify, but it should be longer. It does kick in a little faster as well. So we can kind of maybe catch up to the Botox on your forehead by adding the Daxxify today. Okay. The other thing that can help with the crow's feet here is getting a little bit of volume in your cheeks. Looks like you have some there, but it may be depleting a little bit. So maybe we do a little bit of RHA 4 as well.
What I'm pleased about at Cosmetic Enhancement is the variety of products that are available as people move through the process, and that there were options for me. If people are experiencing that Botox isn't lasting as long, there's options. I'm delighted with how quickly the procedure went, how little discomfort I have in the fact that I could get up and go about the rest of my day. And again, it just makes me smile knowing that I got something done for myself today.
I'd like to thank everyone for attending. Please remember that we have a raffle for a free Daxxify treatment. You'll be notified by the email or phone if you've won. Please also make sure to check your text after the event and reply back in order to book a consultation appointment, and you will be contacted to schedule your appointment. We'd love to chat, so please don't leave, and don't be shy, as our chat questions are anonymous. Please submit your questions and I will answer as many as I can. Hi everyone, welcome. I see we have quite a few people joined us tonight, and I really appreciate you coming. I know we had a fabulous snow day today, and getting more this coming weekend, but very, very happy you're taking some time out on your evening tonight to talk with me and ask some questions, get your questions answered. I'm going to get started. I do want to remind you that the questions are anonymous. I already see some coming through, so I'm the only one who can see the questions, so I will read them as I go. Also want to remind everyone, if you can stay to the end, then you will also qualify for our special. And if you stay to the end, you will be entered into our raffle for free Daxxify treatment. And the reminder of the special is, if you buy 100 units of Daxxify, you'll get a half a syringe of RHA filler for free. And that is any of the RHA fillers. So it will be beneficial to most everybody. That's a $350 value. So everyone qualifies for that if you stay to the end. So let's get started with some of these questions. I've got a bunch already. So how much per unit for Daxxify is the first question. So that's a great question. We have quite a few different fillers available to us at CEC, and Daxxify is $9 a unit, but please remember that you do need to use 2 times the number of units if you're already using Botox, which is $14 a unit with us. Then you will be having to use 2 units for every 1 unit of Botox. So if you've done fillers before, it's a 1 to 2 for Daxxify to Botox. Give you for instance, something like Dysport is a 1 to 3. So it's just a little bit different units, kind of like different milligrams of antibiotics. You just can't compare exactly the right number. So you have to remember that when you're figuring out your price. And units of, thank you, this is so helpful. Okay, how does the pricing compare to Botox or Juvederm? So I think I answered the Botox. With Juvederm, pricing ranges anywhere from $650 to $800, depending on which filler. With all of the RHA fillers, they're all $700, and that is for a full syringe. And if you know and have been to us before, we don't always use a full syringe. That depends on the person, where we're treating. The nice thing about seeing us at CEC is that we use the right product for the right area. You do not need to buy a whole syringe of RHA2 to fill the lips and then a whole syringe of RHA4 to fill your cheeks. You can do, say, 0.2 of RHA2 in your lips, 0.3 around your mouth, and 0.4 in your cheeks of the RHA4. So you can kind of mix and match. You don't have to specifically buy a whole syringe for every area. And that's helpful for people on a budget, but also helps you kind of get a full face treatment without looking overfilled in one spot. All right, so next question is, how is RHA different from Juvederm or Sculptra? So RHA and Juvederm are both hyaluronic acid fillers. Sculptra is a collagen stimulating filler. So they're different significantly than Sculptra. Which is going to be placed mostly in areas that need a lot of volume, the size of the face and the temples, that kind of thing. Whereas hyaluronic acid fillers are best done where you can place it a specific area to create volume, and place the filler where you want it, versus Sculptra where you can't really place it. It's a liquid. You can't really put that around the lips, and is not great at just filling a small spot, like say at the corner of your mouth. It's great for volumizing large areas, but the RHA and Juvederm products are going to be better for focusing around the mouth and getting cheek volume. How is RHA different from Juvederm? They are cross-linked differently. They're made by different companies, both very reputable companies. Revance is actually just merged with Crown Aesthetics, which owns Skin Pen. That is good news that just happened in the last week or two, I think. It is cross-linked a little bit less, meaning HA, or hyaluronic acid, needs to be cross-linked in order to hold in the skin. And RHA was formulated to be cross-linked a little bit less, so it's more flexible and work better in areas of movement. Is this good for smokers' lines to get rid of? And I have two that are really bothering me. Okay, yes. So with smokers' lines, I typically like to first start looking at the lips, seeing if there's enough volume. If there is shriveling and shrinking of the lips, you need to get some volume to the lips first, because if you don't do that, then you're going to be fighting an uphill battle trying to treat a lip line. So we first give a base to the lip to support, and then once we've filled that enough, not too much, we're not trying to make huge lips, we're just trying to give you back what you had before, then we can go back with a smoothing product like RHA Redensity and smooth out that lip line. If you try to do that before creating some volume in the lips, and maybe you already have volume in lips, I'd have to see you to know that. But if you try to do that with somebody who doesn't have enough volume in their lips, then we could risk causing that lip to even disappear a little bit more. So we want to make sure we have some good support there, and then we can also go back in afterwards and smooth out the lip lines with some Redensity. What do you suggest for wrinkles on the cheeks? So wrinkles on the cheeks are oftentimes caused not just from loss in volume, because if you lose volume in your cheeks, you can get more lines across the cheeks, but also from the hyperactivity of the periorbital muscles. when those crinkle in and crunch in, then you will cause lines in the cheeks as well. So a little bit of Daxxify at the crow's feet, as well as a little bit of RHA in the cheeks, is very helpful. And then we can go back and hit more of those cheek lines and even some vertical cheek lines here with some Redensity, basically layering things to make the best result. What is best for marionette lines on the bottom? Well, marionette lines really are going to be best with RHA 3, and I'm not sure what on the bottom she meant, but maybe closer to the chin. Then we might be looking more at RHA 4 closer to the chin. Do you recommend doing a holiday or break from Botox and giving this a try if you're not happy with Botox lately? That is an interesting question. So there are people out there who are developing resistance to Botox after using it for so many years. And the theory behind that is that too frequent treatments, meaning, doing frequent touch-ups every other month or whatever to touch up your Botox, or doing really high volumes of Botox, theoretically maybe causing some people to develop antibodies to the protein in the Botox. And so there are proponents of giving your body a holiday to it. But alternatively, you can use something like Daxxify, which doesn't have the same proteins. It's purified more so that those proteins aren't there, and see if that will work better for you. That's the benefit of trying Daxxify when you're not responding well to Botox anymore. I myself had that issue. Botox started lasting shorter and shorter for me. It was lasting maybe 2 months, and then 1 month, and then all of a sudden it wasn't kicking in anymore. And it was to the point that I was over 100 units of Botox, and it was still not even kicking in. And so I did do a holiday because I didn't have anything that I could use. There was nothing out there. So I was off of it for about a year, tried it again, still didn't work for me. And that's when Daxxify became available. And I still had trouble in the very beginning of using Daxxify. I think it helped, but it wasn't quite as what I used to remember what Botox was doing for me in the past. But then after I started using it longer, I've been using it for about 2 years now, and it's definitely been much better for me. There are some studies showing that the peptides that help to stabilize the Daxxify have been improving the quality of the skin, and the studies even show an increase in elastin and an increase in collagen in the skin, even beyond what other neurotoxins are doing. We know that doing any neurotoxin on the skin does improve the quality of the skin over time, but this is doing that a step beyond that. And I've seen that myself in my own skin. It's definitely been very beneficial in the quality of the skin where I'm treating. Is there typically bruising? So anytime you stick a needle to the skin, yes, you can bruise. Typically with the neurotoxins, including Daxxify, there's really very little bruising. And like I always tell my patients, I make you work while I treat you. I want you to be holding pressure right after I inject, because that little pinpoint bleeding, even that little pinpoint bleeding underneath the skin, can cause a little bruise. So if you're holding pressure right after, you're going to lessen your risk for bruising. But in general, neurotoxins rarely bruise, but fillers are more likely to bruise. But if somebody's very sensitive to bruising, then you can pre-treat with some arnica. Make sure you're staying away from blood thinning medications like anti-inflammatories and aspirin and that kind of fish oils. All those things can make you bruise easier. And then ice and holding pressure right afterwards is really key as well. But the other thing I want to mention about bruising is not inherently bad for you. Yes, it's unsightly, but it's like giving yourself your own PRP. It's not bad for your skin. How much is the product per unit? I already went through that. Do you use the product with Juvederm and Botox? I have used this product with all of it in combination, and have done it over Juvederm and Botox, yes. And I've done Botox on the forehead and Juvederm or Daxxify on the eyes. It just depends on the person. Everyone's a little different. It's kind of like the difference between the non-sedating antihistamines. There's Claritin, Zyrtec, and Allegra. Those three are different brands created by different companies, but they're all the same category medication. And some people love one and other people love another. It's just going to be that way. Some people will respond better to one versus another. And that's going to be the case with Botox, Daxxify, Dysport, and Juvederm RHA Restylane products. It's just the way it is. If you have already had Botox injected, is it compatible, or do you have to wait for the Botox to wear off? Well, we want you to wait until you need it. No sense in injecting something that is not moving. I am also I tend to inject to a natural movement. I don't like the frozen look. I don't think that that's the way we should inject. And I don't like the big puffy cheeks and the big puffy lips. It's just not my preference. You can inject Botox and keep yourself from frowning 8,000 times a day, but you should be able to also, Botox or Daxxify or any of the neurotoxins, but you should also still be able to frown if you want to. If you want to frown, you should be able to. And I think that's the way we should be injecting, so that we don't completely freeze people, but we relax the muscles so you're not creating the lines. That's the best way. Can you treat the lines around my mouth without looking bulky? Yes, you can. And that depends on the type of product that you're using there. We choose that when I see you. The RHA fillers are meant to move well around the mouth, and we still want to choose the right product for the right area. I'm not going to choose RHA 4 for around the mouth when that's meant for the cheeks, jawline, and chin. I'm going to choose something like the RHA 3 or even RHA 2 if it's very fine hollowing, and Redensity for some smoothing. So you choose the right product for the right area and you'll get some really nice non-bulky results. That's another same question. Can we discuss the options for my appointment? Yes. Okay. So we have somebody who has an appointment coming up. We can discuss options at that time. Absolutely. Is Daxxify Botox and the RHA, is the Daxxify Botox and the RHA in the filler? I'm not quite understanding the question, but I think what we're getting at is that Daxxify and Botox are neurotoxins, relaxing muscles, primarily for the upper face. We can use a little bit in the lower face and platysmal bands and subtly around the mouth, but they're for relaxing muscles that cause wrinkles. And fillers like RHA 4, RHA 3, RHA 2, and RHA Redensity, those are all volumizing, and you inject them in areas that are hollowing and sinking. So that's the difference between a toxin and a filler. Can it help the jowls? So yes, subtly you can improve jowls by filling in the cheeks and sometimes filling in the little hollow that happens right in here. and then sometimes filling in the jawline here to pull things back. But you have to remember that there is only so much you can do without making things too full. Again, I like to make sure that we volumize to what looks natural for your bone structure and for your face. And if you need more tightening for your jowls beyond that, we do tightening procedures. People who pair tightening procedures such as Soft Wave or Virtue RF or those types of things that deliver heat to the skin and tighten the skin are going to do better with their Botox, their Daxxify, their RHA, and their Juvederms. They're gonna feel the results are more impactful if their laxity is better from the quality change in the skin. Does the peptide in Daxxify help with skin texture? Yes, absolutely. I think I went over that. The texture in the skin does beautifully with the Daxxify. I've seen it in before and afters with people repetitively now since I've been using it for the last couple of years. How long does it last compared to Botox? So that's a good question. Daxxify can last longer, definitely, but it depends on the person. If you've been using Botox and you're getting 3 months out of Botox, you can get 6 months out of Daxxify. But if you're someone like me who was getting not enough time out of Botox, you might not get that 6 months. I would say most people are getting 5 to 6 months easily. I've seen a few much longer than that as well. How long do you have to wait for cheek filler before you get more? Well, that's something that is individual to the person. Filler in general can last a year. It can last 2 years. It can last 3 or 4 years. And I'll actually see people back years later and still not have to fill them more. It's not the typical to have that longevity, but I've seen it, and it's definitely more common for people to need to touch things up maybe once every 6 months, some people once a year, but definitely touching it up or topping it off with a little bit more is much more common more frequently. When you come in for your Daxxify treatment at 6 months, you might top off your filler with a little bit here and there, rather than having to wait till it's all gone and then doing it over again. Do you use the product with Botox and Juvederm or instead of? It depends on the person, and it will, if somebody is not already using Botox and Juvederm, can you do RHA and Daxxify instead? Absolutely. If they've already had Botox and Juvederm, sure. Even if the Juvederm's not gone yet, we can absolutely layer it on top. That's not a problem. You don't have to wait for it to completely go away. What are the different RHAs? RHA Redensity is for smoothing of lines, really fine smoothing filler. RHA 2, best for lips, subtle volume in the lips. RHA 3 can be done on the lips as well, for someone who wants a little more volume or needs a little more volume, and that is beautiful for support around the mouth as well. And then RHA 4, cheeks, chin, and jawline. I have very few wrinkles on the forehead or near the eyes. I have wrinkles around my mouth and chin only. Are these products useful there? Yes, you definitely do not need to use Daxxify if the forehead and eyes look fabulous and you just have a little bit around your mouth. We can just put a subtle amount of filler in the mouth, around the mouth. Sometimes you can use a little Daxxify around the mouth too, but normally you'll get a better, longer lasting result with filler there. And absolutely we can treat just that area. Again, I will assess your whole face when I see you just to make sure that, we're addressing you as a whole, not just as a lip filler. We want to make your whole face match. But if you're very unmatched already and only need it down here, then that's where we start. That's where we treat. Is there something new to help with nasolabial folds? Nasolabial folds are definitely a challenge sometimes because you get them from sinking in this area and losing volume here, but you also get that from loss in volume here and drop of the cheek down to the nasolabial fold. And so that laxity in the cheek and that loss in volume in the cheek really affects this area. So normally I'll start with a little fill here, get enough volume there to get enough lift, do some tightening in the face to get some improvement in the quality here. And then if we need fill here too, we'll give a little subtle fill here. But you also have to remember that this area should have some dip from here to here. You don't want this to be flat. If this is flat from here to here, that makes for a very weird looking face. That is not normal. Even in children, you have nasolabial folds. Now, they don't have necessarily lines, but they have a different contour from the lip to the under the nose to over the cheek. There should be a contour there. How do these products compare to other dermal fillers in terms of longevity? I think that longevity with fillers, these are supposed to last about 15 months. And I think that in general, all the fillers last generally about a year or more. And it depends on the person. You know, there are people who eat filler away in 6 months and need more. But like I said earlier, there are people who a couple years later, they still don't need any lip filler, that their lips are still as full as they were the day I put it in. So, and years later, and I have plenty of examples of that in my practice. It's body chemistry and rechecking it and doing your maintenance treatments. You're going to need your neurotoxin typically at least every 4 to 6 months anyways. So you come in, we check it, we look at it. Do we need a little top off? We'll do it at that time. What else? Is there any downtime? Can you exercise after treatment? Yes, absolutely. There is basically no downtime. I mean, the only downtime you could possibly have for any of these is just maybe a little bit of swelling, maybe a little bit of bruising from fillers, but not true downtime where you're laid up. And as for exercise, that comment generally pertains to neurotoxins. And I always say that's kind of an old doctor's tale. You do not need to stop your exercise just because you had some filler and some Botox. We used to tell people that when it first came out, when we didn't know why people got facial droops. Now we know it's because the doctor did it wrong. It's not about you having a facial or standing on your head. You didn't do anything to cause it. It was done wrong. That's what happens. So, definitely, we don't want you doing an Ironman the next day because that causes a lot of facial swelling and swelling in your body. But other than that, your regular exercise should be fine. All right. Can you review Daxxify? I missed the intro. Daxxify is a neurotoxin that lasts 6 to 8 months, has a very rapid onset. You usually will have your full effects within a week, and can be very helpful for people who aren't getting their longevity from Botox anymore. How long do these last compared to Botox and Jubrum? Got that question answered. Should you get a facial before or after RHA and Daxxify? If you get a facial after, how long should you wait? Okay, so before is not a problem. You can do your RHA and Daxxify immediately after a facial. That's not an issue. Anytime you stick a needle in the face, you're probably not going to want to do a facial immediately after, primarily because we just made a bunch of holes with needles. And so we don't really want you to get an infection. And so doing a facial about a week after is a safe bet. Now, couldn't you push it a couple of days sooner than that? Sure. Really, technically, the needle holes close within 6 to 8 hours by studies, but to be safe, we say a week. How about hollow bottom of the eyes and dark circles? All right, so hollowing in the bottom of the eyes happens from volume loss, thinning of the tissue under the eyes, and sometimes pigmentation as well. You will develop pigmentation under the eyes from sun damage. Some people get it hereditary pigment there. I am not a big proponent of filler under the eyes unless you have true deep hollows. Too often people want to fill in the crepey skin under the eye with fillers and end up with puffy eyes and cheekbones that go right up to their eyelashes. Not a good look. It makes you look puffy and tired. I don't think that it's a good place for filler. Can you subtly put filler there for somebody who needs it? Absolutely. I think, though, under the eyes, the best treatment is laser tightening and sometimes a little Daxxify for around the crow's feet to help with the wrinkles there, and then filler in the cheek to volumize the cheek. That sometimes can help with the under eye by pulling the tissue tighter. But there are definitely some great laser treatments for under eyes, and we can talk in consultation about that if you're interested. All right. If you have a special on microneedling skin pen at the moment, 20% off microneedling package through the end of February. Yes, we do have a special currently for 20% off packages of microneedling. Yes, through the end of February. So if anybody's interested in that, skin pen treatments as well as Virtue RF, we have a special going. How do you treat marionette lines and jowls? So marionettes, again, filler here to volumize here, usually RHA 3 and 4 if it's at the jawline, which sometimes you'll get a little dip here in front of the jowl, and a little subtle amount there is helpful, but you got to be careful because we don't want wide jaws. That's not a feminine look. More narrow jaw or chin and jawline is more feminine. If we're going to treat a man's jaw, then absolutely volumizing here makes it look more masculine and helps with the jowling, although men do get less jowling than women do. Can you use RHA under the eyes for eye lines? I don't recommend under eye filler unless somebody truly has volume loss and hollowing. For lines, you're better off doing a laser treatment for the crepiness and the surface texture. Any products for filling under eyes? Products for filling hollow under eyes, I typically will use PRP if we're gonna start. If somebody really is not responding well and needs that volume, then a little Redensity there can be helpful. How much longer does Daxxify last? About 6 to 8 months is what the studies are showing. Some people might get less depending on whether or not they've had neurotoxins in the past. If they have and they're not getting long-lasting results with those, then they might not quite get the 6 to 8 months with Daxxify. Okay, that was a nice one. I just said it wasn't a question, not a question, just saying I trust and love going to get my injections. Yay. Do you do a lot of men as well? My husband is watching and may be interested. I absolutely do men. Men get treated a bit differently because we don't, like I said, we don't want pointy chin in a man. The men have wider jawline, and so we treat that differently. We treat the cheeks differently. We don't want, very feminine high cheekbones on a man. So there are special considerations to treating men, but yes, absolutely, we treat them all the time. I'm hesitant to buy the $100 before having a consultation to get my person's professional input on what is appropriate for my face and skin. Yes, absolutely. You don't need to buy today. You can do it when you come in for your consultation. We have all the list of people who signed up and who have finished the event tonight. If I buy 100 units of Daxxify and don't need that much, can you save it for touch-up? Yes, that can be done, but the 100 units of Daxxify, if you've ever done Botox, is about equivalent to 50 units of Botox. So if you're already at that dosage with Botox, you'll be able to use the 100 units pretty quickly. And yes, are you in the Portland, Maine office? I am in the Portland, Maine office most days. I go to the Waterville office once a month and the Falmouth office once a month. But we have providers in all of those locations that do all of these products, not just me. Okay. So somebody's asking about tightening treatments. I would suggest that you schedule a consultation with me, and I can go over specifics for what's going to be best for your skin, because we have a lot of tightening devices, and best to talk to you in person about that. Will fillers diminish my dimples? They can if you treat them, but you don't have to treat dimples if you don't. If you like your dimples, you can keep them. I have treated people who didn't want their dimples to completely go away, but wanted to, because they were getting really deep with age. I treated them with some filler to help to lessen how deep they were. You can adjust how much you put in. All right. Got a lot of questions popping up here. Is Daxxify a filler or a procedure? Daxxify is a neurotoxin, which is like Botox or Dysport, and will relax the muscles around the forehead, frown line, eyes. Can be used subtly in the lower face as well, or in the neck. Which RHA lip filler is close to Volbella? Probably the closest would be the RHA 2. It's a soft, subtle volume lip filler. And can we dissolve the old lip filler and use one of the RHA fillers? Absolutely. That's 100% possibility. I've done that before for people who, have migration of filler or just didn't like the way the filler was placed and needed to start from scratch. Totally can restart from scratch. Would RHA help with the jowls? I think that jowls do really well with tightening procedures, but also can have some subtle improvements with treating in the jawline, as well as in the gonial angle on the back by the ear. How much is 100 units of Daxxify? 100 units of Daxxify is $900. And that's equal to 50 units of Botox. What is the equivalent units of Daxxify to Dysport? Okay, that's a challenging one, because I have to go from Daxxify to Botox to Dysport, because I don't think in those terms. But Daxxify, so one Daxxify unit or one Botox unit is equal to 2 Daxxify units. One Botox unit is equal to 3 Dysport units. So it's kind of a 2 to 3 for Daxxify to Dysport. okay? And I can help you specifically if you know how many units you use. And all right, looks like we're done.